Thanks for joining in as we highlight the important points about the non-steroidal anti-inflammatory drugs that selectively inhibit the activity of cyclooxygenase 2, or COX-2. Hopefully you've already watched as we discussed the non-steroidal anti-inflammatory drugs that affected both COX-1 and COX-2, the ones like ibuprofen and naproxen. Etoricoxib, celecoxib, and other drugs that end in the suffix COXIB are non-steroidal anti-inflammatory drugs that selectively inhibit the COX-2 enzymes. These drugs inhibit the enzymes that make chemical mediators called prostaglandins. And by decreasing the enzyme COX-2, these decrease pain, decrease fever, and in higher doses, decrease inflammation. Their action on the pain pathway is right here. And that's the point at which the nociceptive impulses begin. With the COX-2 inhibitor, there's less inflammation at that site, less sensitization of the nociceptors, and fewer action potentials are generated. And at the level of the brain, that's felt as a reduction in pain. We use prostaglandins all through the body for maintaining homeostasis, and when these selective COX-2 inhibitors were first discovered, we thought, that'll be great, there won't be any side effects. Because at the time we thought that the COX-2 was responsible for just the inflammatory prostaglandins. Unfortunately, the COX-2 enzyme is also going to make some of the protective prostaglandins that are involved in homeostasis. So while the COX-2 inhibitors are not as harmful to the GIT as other non-steroidal anti-inflammatory drugs, and they do not significantly affect platelet aggregation, they're still associated with significant nephrotoxicity. The effect on the kidneys will also decrease blood flow through the kidneys, resulting in increased fluid retention and possibly hypertension. But the most alarming of all is the fact that these drugs, the selective non-steroidal anti-inflammatory drugs like celecoxib and Etoricoxib, are going to be associated with a very high and increased risk of thrombotic events such as strokes and myocardial infarctions. And therefore, as with every analgesic, they should only be taken by the individual if that individual is getting significant relief from the pain. They should only be taken on a full stomach, and they should be used in the smallest effective dose for the shortest possible time. And now you know. Thanks for joining me.